Are you able to see my screen? Audio video clear? Can I have a thumbs up from anybody? Lovely. Thank you. Thank you. Okay, so today what we are going to do is we'll start with in the osteology section. Basically, we have four bones which are important to us. One remains your mandible. Second is your maxilla. Third is your sphenoid bone, and fourth is your base of skull. Base of skull is not an independent bone, I'll say, but it is as good as a entire section. Okay, your entire squat round deals with skull base. One section is there. Okay, so that will remain one of the key area, and this skull base wala thing will again be revised when we'll be doing the recent advances again. Okay, so whatever the foramina are there, whatever possible questions are there, they will be started with that. Just a minute. Dr. Revati, you were logged in or message आपका भी आया? Okay, so let's start with today's session. It will be around 35 to 40 minutes of class. We'll be dealing in total with your mandibular and maximal over here. And after that, we'll deal with few important questions of your biostats, just to break the monotony. Okay, because I feel biostats and HPE are one of the most neglected and most gruesome topics. Okay, so let's start with today's session. The first question: identify the deformity. My screen is visible to you guys? Lovely, it's visible ना? Dr. Revati, I request एक बार please log out करके फिर से log in कर लीजिए, है ना? There will be some network issue, otherwise somebody else will also have faced the same problem. Okay, just log out once and again log in. Okay, we'll wait for 20 seconds. ठीक है. So the first thing becomes your what is the name of this deformity? This has been already asked once. This deformity is seen in your mandibular defect, basically the anterior mandibular defect. And the name of this deformity is
anti-gum deformity.
Anti-gum deformity. Okay. So remember this name. Okay, it's a named question. Moving over here, this is the description about what is this anti-gum deformity. Just go through it once. Okay, this is basically named after one comic character. Okay, so I'd like to take you what are the divisions of your mandibulectomy, because here two named questions will be there which are very important to you. You'll just see them in another 5 minutes of time. So the first one remains your segmental mandibulectomy, in which you remove a segment of it. Basically, there is a resection of full thickness. Okay, and this is generally posterior or anterior. Okay. This is generally posterior or anterior. Okay, so if you do it, there is facial deformity is there, which we saw earlier, because there is lack of stability. Okay, another type of mandibulectomy is your marginal mandibulectomy. Marginal, in which what happens, you just take out a rim of mandible. Basically, there is the arch of the mandible is maintained. That entire thing is maintained. The arch is maintained. Okay. Now, over here, as you saw this thing, this image has already been asked once. Okay, and the name of this classification goes as Arkin classification. Okay, so basically what they do is they divide it into two halves. Each take line, you divide it this side and this side also. Okay, this remains your condyle. Okay, then there will be ramus. Mnemonic is given downside only. Then there will be your body, and this will be your symphysis. Okay. So please remember this named classification of your mandible, Arkin, And there is one more. This is the older classification, HCl Boyd classification. Name of this also you should remember. Okay, so in mandible there are two name classifications which are commonly used. One will be your Arkin classification. Second will be your HCl and Boyd classification. Now third, please remember, reconstruction of everything, whatever you are removing remains a question. Okay, so flaps we'll discuss in depth also, but over here just see the important questions which can be asked over here. So how will you reconstruct the mandible which you are removing? Okay, so I'm not going into the details like when all you'll remove the mandible and all. So that's all pretty whenever it is involved by any tumor, any growth. Okay, so there will be removing it. So over here, two names you have to remember. The first name you should remember is THORP, Thorpe. Okay, so Thorpe, say the full form of Thorpe is also important. The full form stands for titanium hollow
Osseointegrated reconstruction.
Great. Okay, just in a while you'll see the image also of this osseointegrated recon plate. But this full form you should remember, this is important. Okay, believe me, out of your 20 questions of 100 marks, around 2 marks to 3 marks will be there for expanding these kind of abbreviations. Okay, so don't neglect them. These are important, these are easy to make questions and you'll get full marks in them. Okay, so remember there's one thing called as Thorpe. Second is your fibula flap. Second is your fibula flap. You'll see the image of this fibula flap also just in a while. And what questions can come from this flap, we'll see here only. Okay, so let's see. Identify the flap, name two uses, mention what things will you keep in mind during harvesting of the graft. Okay, this image I have taken from Google itself. Image can be manipulated, one or the other thing is there, but you can easily say that this is our fibula flap. Okay, and where do we use it? So one, you should remember mandible reconstruction. This is very important and one of the very prime use of this fibula. Okay, and second will be your maxillary recon. Okay, now what things you have to take care of it? We all know that niche say there is ankle joint over here, and proximally also there are important structures over there. So what all we have to take care? Distally, you have to spare 5 centimeter of fibula so that your ankle is stable. Okay, ankle is stable. This is preserved. The stability of ankle is preserved. And proximally, again, number is same, 5 centimeter, approximate 5 centimeter of upper fibula you have to preserve to avoid injury to which nerve? Common
Peroneal nerve.
Okay, so this is the question which can be added into your free fibula flap. Okay, so please don't forget it, it is important. Now, coming to another one of the newer topic, this can be asked in your recent advances, that what is distraction osteogenesis? Okay, so I would like to tell you that you might have remember in your like ortho ward mein what they do. I'm forgetting the name of that thing. They basically stretch the bone. They put in plates over the fibula, over the thigh, like femur and all, and they stretch it daily and daily so that in order to help it growing. Okay, so basically what is this distraction osteogenesis is this is basically a technique of growing new bone by stretching the pre-existing bone. Okay, so this is a 1 mark question, that what is distraction osteogenesis and how do we go about it? This is something, first of all you will cut it. So cutting is osteotomy. Then there will be something called as latency period. Why is latency important? It is not important from ENT point of view at all. Only important just in case if it comes in exams, you will have to write for 1 mark. What happens in latency? There is callus, something called as callus, which is formed. Then what happens? Then there is distraction. Distraction में क्या करते हैं? खींचते हैं इसको. You have to move it. And what is the rate? 1 mm per day. Okay. And then basically It is consolidated after the desired length is achieved. Okay, now another two questions which can come from mandible are over here. First, common site of fracture. Second is your difference between adult and pediatric mandible. Okay, so it is given over here. Please rectify it. It is important. Okay, it is important. So moving over here, this is for people who are too much enthusiastic to learn. If at all even after going through these things you still have capacity to learn more, please see the attachments over the mandible. Okay, please see the attachment over the mandible. Still after that, even if you feel that Navi I am not saturated yet, still I want to read more about mandible, on YouTube video by Dr. Virendra Kadian. Kadian hai ya Kadian? I'll share you the link of this video. Okay, so all your hard bone anatomy, though they are longer, but your concept will be cleared. Okay, so I had recommended it for sphenoid bone per se, because sphenoid is I'll say it's a small bone, but still it's very confusing and given in a haphazard way in most of the places. Same goes for base of skull. So both of them please study from this. I'll share you the link of this. Please go through it. Okay, now identify this image. So अगर ऐसा कुछ भी मैंडिबल का इमेज आता है, the answer remains Thor. ठीक है, full form you should remember, and this is second thing. Now second question is this is they have mentioned what are the common sites of fracture. So don't remember most of the thing, only remember what is the maximum, है ना? तो condyle you should remember that this is the place where the maximum number of fracture take place. Okay, so here they have given some detail about the Thor. If you want you can go through it. From my side just remember the image of Thor, one full form of Thor, बस इससे ज़्यादा और तो नहीं पढ़ना है इसमें अपने को. ठीक है. Now coming to maxilla. So these around 15 minutes are good enough for your mandible. ठीक है. Make whatever your notes you have made of your mandible, please update it into it. Okay, so that it doesn't bothers you much. And believe me, if you revise it once or twice, see the anatomy videos of mandible, you'll be good to go. है ना? You can no mistake from mandible point of view. Now coming to another brother of mandible by the name of maxilla. Okay, so again we'll not go that of that routine anatomy classification कि इतना surface है, इतना process है, वो everybody forgets it, है ना? We are not doing anatomy. Just go how this question might come, what questions can our probability are there, and how to answer those questions. Okay, so two classification which you have to remember over here. One is your Corduroy classification. Second is your Brown's classification. Okay, so please go through them. So what they have done is basically they have divided the maxillectomy, basically the reconstruction of maxillectomy into multiple types. Okay, some people use Corduroy, some people use Brown's classification. Whatever is being used in your institution, you should remember that at least in detail, and the name of at least the other one, that if God forbid the other one comes in the OSCE, so you can write something about it. Okay, so basically what is type 1, what if type 2, 3, 4, 5 and 6. Okay, so the corresponding images are given over here, just go through that. Okay, now coming to recon option of maxillectomy. Okay, any 2-3 things you should remember. Okay, first will be your rectus abdominis flap. Second will be your radial artery flap, radial forearm flap. Not connecting. Just a minute. Check. Third will be your this pedicle muscle flap, or you can easily remember the free fibula flap. Okay, it remains the same for your both, whether it is maxilla or it is mandible. Okay, so this is a kind of prosthesis which the dental people or the OMSF people make for the maxillectomy defect. Basically, it is forms a surface for the palate which we are removing. Okay. Okay. Now coming to types of maxillectomy. Okay, so you all remember these are the more like common types of maxillectomy which we see routinely. This is the medial maxillectomy. This you have to remember, and then total maxillectomy. This you have to remember. Not much. I'll not take you more into the theory thing so that lest you should forget everything. ठीक है, ये दोनों याद रखना है. Medial maxillectomy. What is medial maxillectomy? What are the steps of medial maxillectomy? Same goes over here. Steps or where do you give osteotomy cuts? Thank you. ठीक है. तो पहला होता like what it is. One. Second point is where do you give the cuts of maxillectomy? It is asked. Okay. It will be asked for 2 to 3 marks. अगर if this is there. Okay. So basically, this is the detail about medial maxillectomy, and over here they have differentiated what is infrastructure maxillectomy and suprastructure maxillectomy. So basically, only one difference is there, which I feel you should answer over here. That over here, orbital floor is intact. I'll highlight it. Okay. That in infrastructure maxillectomy, surgeon will remove the hard palate, lower part of the maxilla, along with some part of the teeth, but the orbital floor is intact. Going to the suprastructure maxillectomy, here we remove the orbital floor and upper part of the maxilla, which is highlighted over here. Okay, so this is one of the main difference between infrastructure and suprastructure maxillectomy. Okay, so I'll share with you guys one PDF. Basically, there's a online journal paper discussing in depth about these both of them, maxillectomy as well as mandibulectomy. Okay, so I've taken the important points from that journal and listed it over here. So people interested in going into depth, please go through that journal. I'll share it to you. Okay. So these are your cuts for medial maxillectomy. So these are the cuts for, please remember them. These are important. Okay, both for medial as well as total maxillectomy. Now over here, this is a repetition and revision sign. Maxilla mein, there was an image, I thought it should be there for the revision. This is your nipple sign. Okay, and for what does it show? What does it mean, this sign? Can somebody unmute and answer?
Anterior ethmoidal.
Anterior ethmoidal artery. Now again, can somebody unmute and tell me what is the distance between anterior ethmoidal artery, this and
12 mm, 24, 12, 6.
24, 12 and 6. Okay? Okay. So that is one more of the revision question. Okay. So these are the sequence for osteotomy cuts. This is basically as the numbers which they have mentioned, 1 to 7. 1 to 7. Okay. So if you want to corroborate and read, you can corroborate and read. But my point is, you should remember these. Okay, this is ratta. ठीक है, there is no explanation, इसको याद करना है. ठीक है, if it comes in exam, तो वहाँ पे believe me that in that 4 minutes you won't have time to think and answer logically. Okay, so if you have learnt it, you know it, you'll answer it, else it will be skipped. And acha, 2 more points from my side. One is there is generally no negative marking. Initially, what used to happen in DNB, there were negative marks also, especially in the counseling sessions. Okay, so as of now, in all your 20 stations of OSCE, there will be no negative marks. Okay, and there will be subset of marks given to each of the question. Like, just I'll take you 1 minute. Like, अगर suppose question number 1 है, इसका part A, B and C है, इसका 1 number, इसका 1 number, इसका 2 number. Okay, so howsoever in depth you write about question number A, you will get maximum 1 mark. Okay, so if you have not answered ये, तो 2 नहीं मिलेगा, 1 नहीं मिलेगा. So believe me, make it a habit whenever you attempt any OSCE, answer all the parts. Answer all the parts. Don't leave anything spare. Don't leave anything blank. आप blank छोड़ोगे, वो गड्ढा बनेगा, गड़बड़ हो जाएगा. ठीक है? This same what happens in theory ना? DNB theory what they do of question number 1, they'll say page number 1 to 5 is for question number 1, or page number 6 to 10 will be from question number 2. So if you answer over here 7, 8, 9 page भर दिए, तो इसका number नहीं मिलेगा. You won't get that number. Okay, same goes in the OSCE setup also. You have to answer everything. It shouldn't be there that I put my brains everywhere and I skip some of the questions. So it's like not a very wise step to do. Okay, So over here, this is the second brother of maxillectomy by the name of total maxillectomy. Okay, so basically you will be, what you are gonna do over here is, you will be resecting the floor, the medial wall of the orbit and the ethmoid sinus. Mota mota. ठीक है? And done for the malignancy of your maxilla. Okay. Okay. They might ask this question also. What are the complications? Okay. So complications में how you can enumerate them? It's given over here. ठीक है? Injury to orbital contents, lacrimal drainage, optic nerve, ethmoidal arteries, intracranial contents, and there might be some bleeding and all. Okay. Now here the sequential osteotomy cuts are given. How you will go about the osteotomy. Coming to the next part. Coming to the next part, this is maxillary artery. I will take 2 to 3 minutes of your precious time and just I will try to break down the branches of maxillary artery. ठीक है, this can be a potential viva question तो पूछते हैं कि what is the branches of maxillary artery. Just a minute, please. So there are mota 3 parts. Okay. So the first part, who cooks food in our house? Maid. I know the spelling is wrong, but please remember it like that. You tell maid that, listen maid, make dinner before party. ठीक है, मेड को क्या बोला? Make dinner before party. अभी तीसरा बात करेंगे. ठीक है, so just enumerate it over here. M A I D. So M stands for middle meningeal artery. A stands for your accessory meningeal artery. I stands for your inferior alveolar artery. Okay. D is for your deep auricular artery. Okay. Now, what is there left? Make M. M से आपको हो गया mesenteric artery. T से हो गया deep temporal artery. B से हो गया buccal artery. And P से हो गया pterygoid artery. ठीक है, there is one additional over here by the name of anterior tympanic artery. Okay, and over here, just last step of this. There is some pig who gave some exam and वो pass हो गया. Pass हो गया. So P I G. ठीक. P stands for your posterior superior alveolar artery. I stands for your infraorbital artery. And G stands for your greater palatine artery. And pass again, smaller arteries are there. P A S. P से हो गया pharyngeal artery. A से हो गया artery to pterygoid canal, and S से हो गया sphenopalatine artery. Okay, so this is not my mnemonic basically. This was shared by one of our senior, one of my senior, Chauhan sir. He is presently doing head and neck in Trivandrum. Okay, so what I wanted to say, this kind of question can be there in your table viva. Okay, now you will just search out one thing. behind which muscle or behind which structure does this maxillary artery divides into three parts? Okay. If you remember it, unmute and try to answer. And if you don't remember it, again today, give 10 minutes to your maxillary artery section. Okay. And read about it and just let me know. नहीं मिलता है तो please let me know. Okay. So, one out. हाँ बताओ.
Lateral pterygoid.
Lovely. Correct answer. ठीक है. See, believe me, you have to practice this thing. This might not be very important thing, but suppose if you have rectified this thing, okay, so what will happen is, suppose your table viva on recent advances is going somewhere around skull base, and you try to bring him to types of the branches of maxillary artery, and wait for examiner to ask, like, and believe in God, if he asks you what are the branches of maxillary artery and you tell him these are three parts mein hai, dividing behind lateral pterygoid, and this is how we go. First part, these are the branches. Second part, these are the branches. Third part, these are the branches. He will give you extra marks. Not extra marks, 50% to pass ho jaoge. You will get more than 50% marks. Okay, so there are certain things which you should remember and try to fit in everywhere. Like what used to happen with me, I had remembered one Delano classification when I was in late first year, second year tak aate. So anytime any viva was going on, I used to utter this word Delano. And people have this habit, we dig our own grave. So our viva generally goes upon what we say. Like he wants to listen ki aapko kya aata hai, and whatever you utter, over that your viva will go on. So one or two things you should remember. You speak about it, let the examiner fire at you. Ki, tell me, you spoke this thing, tell me what is this, and be ready with that thing, and be ready, and you should not get stuck while answering that thing. Okay, give the feel to the examiner that this candidate knows it. He deserves more than 50% of marks in that table viva or in that question. Okay, so moving a little bit ahead. So this is a previous year's question. Just go through it. I'll read it. A 65-year-old male patient presented with left maxillary swelling, blood-stained nasal discharge, left orbital proptosis, diplopia. Patient underwent surgery. Patient underwent surgery for the same. Following is the specimen. Now, please tell me, what is the surgery done? Can somebody take a try?
The total maxillectomy.
Lovely. ठीक है. Second. So we have seen what are the recon options for maxillectomy. Okay. Now see this thing. Now they are asking it for 2 marks. ठीक है, कि what are the osteotomies you are required to perform during this operation? And believe me, what is the most difficult part of this question? Do you know? The most difficult part of this question is this thing. The time which is running behind. As believe me, once you read the question entirely, आप देखोगे कि ये 3 मिनट से कम पे आ गया. And normally we have a habit, we read it once or twice. So your time will be almost 2.5 minutes, 2 minutes. So that is the place where the panic comes. That is the place where we make mistakes. है ना? So try practicing these type of questions. Maxilla में ये आया है. This was I think 3 sessions back. Okay. So possibility है, either they will repeat something from maxilla or they will repeat something from mandible. Okay. So these are the branches of your maxillary artery. Okay, so here they have collected it, collectively given it. We have tried to break it and try to learn it. Okay, so these are the these things. Apart from this, what are remaining is skull base and sphenoid. Both of them will again revise in when we go for a recent advance. Skull base wala jab revise karenge. For the people who have joined us late, it will be new for them probably. Otherwise, the previous people, it will be a revision for you. Okay, so both of them we will do it in the recent advance and skull base. Now another 10 minutes I'll take, please be with me, for revising some of the important questions from the biostatistics section. Okay, believe me, this was personal my experience. Biostatistics and HPI I never liked. Okay, somehow it was like just I have to give the exam and pass. Okay, so I have collected all the important questions of biostatistics. So most of them are repeating in a set pattern. There are around 8 to 10 questions. They get repeated. So I've tried to include them in this PDF. The remaining one, there is obviously something or the other gets remain. So we will cover it in the daily WhatsApp sessions. Okay, believe me. Study the level of evidence given below and answer. What are the steps of RCT and what are the types of blinding? Okay. This triangle, this itself is very important. And they might ask you that please tell us what is this, what are the levels of evidence. So you should be ready with this thing. This itself is a question in own. 1 number के लिए, 2 number के लिए, they can ask you. Now coming to is, what are the RCT? So RCT is basically the randomized controlled trial. Okay, RCT is basically randomized controlled trial. So what they do over here is 3 steps basically, not more. You take some protocol. First step, you draw a protocol. You select your experiment group and the reference group. 2, and this is basically randomization. They say it's the heart of the RCT. And then you go for manipulation and follow-up. These are the 4 steps of RCT. Okay, please remember it. है ना? There is no logic in biostatistics and PSM. Okay, I remember from my UG days, PSM was short form was PSM is Pelo Socho Mat. Whatever you want to write, just keep on writing. So I believe it's all part of that only. Okay, so just please ratify it. If it comes in your exam, write it, and unless until you are very much into these things, please forget it. Okay. So over here, one more thing is there. They can ask you what is blinding. This can be a question. They might ask you, what is blinding? 1 number के लिए, ठीक है? So blinding is basically a tool to remove the bias. And 3 type of blinding is there. 3 type of blinding is there. They can ask you what are the types of blinding. So please remember this thing. PIA. Okay. So in the first one, the participant is blinded. Okay. That the participants don't know in which group are they gonna be there. Now in I, what happens? Participants plus investigator, both are blinded. दोनों को नहीं पता कि which is in the experiment group, which is in the reference group. And third is A. A is all 3. P plus I plus analyzer. All are blinded. Okay. God knows why they are doing the study. Everybody is blinded. I'm sorry. Okay. So please remember it. This can be a 1 mark question. What is blinding and what are the types of blinding? Okay. Second question. What is impact factor? How to calculate it? Believe me, of late, a recent trend has been started to give you some calculation-based question. Okay, they might give you certain thing and they will ask you to calculate. Okay, so please go for the specific formulas. Okay, what is this impact factor? That you should remember. That it measures the average number of citation to the articles for many journals. Okay, and how do you calculate it? This is there. Okay, they'll give you the data. They'll give you this data. They'll give you this data, and they'll ask you what is the impact factor. Okay, always remember 2 merits, 2 demerits everywhere. ठीक है, दो याद करना है. ठीक है, how to calculate it? This is just example given over here. Go through it. ठीक है, and this can be a potential question. ठीक है, this can be a question. Second, what is H index? Again, same. The full form of H index is your Hirsch index, and it measures the impact of the particular scientist rather than the journal. So it is basically more of a personal orientation of the same thing, whatever you have read above, for single author per se. Okay, this is, they have cited about H index. Okay, good. There's one more question. What is, what else they can give you? How it can again be asked? They can tell you that they can give you like this, that so and so journal, so and so article is there. H index for the above is 10 or 8 or 5, whatever. Now explain what do you mean by this. Okay? So there will be people like me who don't even know what is H index while giving the exam. Okay, so how will you explain what it is? So believe me, read about it. Okay, this is important. It could be asked to you. What is I10 index? What is H index? Okay, so this is how you have to explain that this is the meaning that this much amount of articles has been cited as so and so number. Okay, similarly, one more. What is I10 index? Please remember it. Okay, so these 3 questions. Okay, what else are there? Generally what happens कि I10 index is used when your number of publications have more than 10 citation. ठीक है. Now there is one full form by the name of DOI. Can somebody take a try? What is the full form of DOI?
Digital Object Identifier.
Great. ठीक है. Second question. Third question will be your Vancouver style. I'm sorry if I made any spelling mistake in Vancouver. Please go through it. Please practice it once. ठीक है. I'll show you one question. They have given one article. They have shown you one image of the article and they have asked you write it in Vancouver style. ठीक है. So I'll share you one video also if you don't know it how to write it. आता सबको है, we know it, but since we have not practiced it, we tend to make mistake. तो गड़बड़ हो जाएगा. So it shouldn't happen. Okay. And then comes the fourth question, which is very important, which is the Kaplan-Meier curve. ठीक है. This is important. ठीक है. This is basically survival index. I'll show you the same in the below setting. Okay. So this is the Kaplan-Meier curve. They'll show you this type of two graphs. Okay. One or two other, and they'll ask you what is the meaning of this. This is you have to remember. And this is another question. What is hazard ratio? So this is basically the measure of the difference between the two curves in the Kaplan-Meier plot. Basically, what is the difference in the survival of group 1 versus group 2? Okay? You will find this Kaplan-Meier curve when you will see oral cavity discussion. In Scott Brown also this it is given that अपने D'Cruz et al. Sir का जो journal है उसमें they have mentioned this. This is the group 1. This is the group 2. Treatment of N0 neck with therapeutic neck dissection and elective neck dissection. Okay, so they have mentioned it over there. So this can very well be given to you in the OSCE also. That describe what does that mean? What is this art measuring? Okay, so just see this. What all we discussed. This was asked 2 years back, and very highly chances कि इस तरीके से similar questions will be there.